Okay, so you can see here, as we discussed, we have acetylcholine or acetylcholine, then we have histamine, then we have prostaglandin, and we have gastrin. Okay, I will start with the first one. Sorry. So acetylcholine bind to the M3 receptor. M stand for muscarinic receptor. Activate and enhance something called deacylglycerol, IB3, and this will lead to the formation of calcium. Increased calcium will activate protein kinase. Activate protein kinase will stimulate the proton pump and increase release of acid. Okay, number one. Acetylcholine bind M3, increase calcium concentration. This will lead to the activate protein kinase and activate, at the end result will be stimulate or activate proton pump and release the proton, release the hydrogen. Hydrogen at this space here will be conjugate with the chloride and cause hydrochloride in the GI system. Okay, this number one. Number two, similar pathway. We are going to speak about similar pathway here. The similar pathway will be gastrin. Gastrin bind to the gastrin receptor. The same, increase calcium formation. This will lead to the activate of protein kinase. You can see the plus here, mean activation. Activate protein kinase. And this protein kinase will be involved in the stimulation of proton pump and proton pump or the hydrogen potassium ATPase, and this will lead to the increased release of hydrogen. Okay, gastrin. Then the third one, so you can see we discussed two maybe mediators with a similar pathway. Both of them increase calcium. Both of them increase calcium. What about other mediator? The other mediator, I will clean this one to make it clear for us. Okay, the other mediator will be the histamine. Histamine bind to the H2 receptor. H2 stand for H2 receptor here. H2 histamine receptor. Histamine bind to the H2 receptor. Okay, this will lead to the activate GS protein. GS protein will enhance conversion of ATP, adenosine triphosphate, to cyclic AMP. Okay, GS activate, enhance cyclic AMP, and enhancing cyclic AMP, this will activate protein kinase, and protein, when the protein kinase activated, this will lead to the stimulation of proton pump and release the hydrogen. Now we can understand, or we can ask question, how histamine release acid in the stomach by activating GS protein, increase level of cyclic AMP, and activate protein kinase. Number one, done. So moving to the prostaglandin, how the prostaglandin work on the GI system. They said prostaglandin bind to the prostaglandin receptor, so you can see it here. Prostaglandin activate prostaglandin receptor in the parietal cells. This is parietal cells. So please remember, prostaglandin bind to the prostaglandin receptor. Okay, so what happened next? What type of protein will be affected? Okay, GI protein will be enhanced, activated. So GI protein will be activated. When you say GI, I stand for inhibitory effect. So that means when the prostaglandin bind to the receptor, activate GI protein, the result will be inhibitory effect, inhibit adenine cyclase. The result will be inhibit adenine cyclase. Okay, so what happened there? When you inhibit adenine cyclase, when you inhibit adenine cyclase, okay, when you inhibit adenine cyclase by prostaglandin, the result will be decrease, inhibit. So this step will be stop here. Okay, when you have inhibitory effect, that means we have decreased level of cyclic AMP. That means we have decreased activation and decreased secretion. For this reason, they said prostaglandin inhibit effect, decrease secretion of acid. So prostaglandin, the end result will be decreased secretion of acid. Okay, so which of these mediator associated with the decreased secretion of acid? Prostaglandin. Which of these mediator associated with the increased acid? Okay, increased acid. Okay, we have acetylcholine, increased acid, histamine, increased acid, and gastrin, increased acid. So we have only one mediator in this diagram here, in this image. Decreased acid will be prostaglandin. Okay. Okay, we're done now. And now, if you look on the diagram here, we can start to predict, and you can start guessing which medication we are going to use to treat peptic ulcer disease to decrease acid secretion. What type of receptor we are going to use? Okay, we can use some medications, and we have a discussion now. What type of medication we are going to use? We can use some medication able to inhibit, for example, acetylcholine. So that will be good. We can use some medication inhibit histamine, and we call this one histamine H receptor antagonist. Okay, we can use prostaglandin. What type of prostaglandin? Agonist or antagonist? Okay, I will leave it for you to tell me that. About muscarinic, we need to inhibit muscarinic in order to decrease release. We can use some muscarinic receptor antagonist. Okay, then prostaglandin, what do you think here? Stimulate or inhibit? We need to stimulate. We call this one analog. Okay, analog means stimulate prostaglandin, or use something to inhibit gastrin. Okay, this number one. Also, they said we can use something to inhibit proton, and we call this one proton pump inhibitor. We have other approaches. We are going to discuss it later on. So here, from this slide, we need you to remember what type of receptor do you have? Number one, what is the effect of this receptor? If you activate this receptor, what happened? What type of pathway? What type of second messenger will be involved in this effect? Okay, so you can see here how many groups. Number one, we can use something to block acetylcholine. And here we have suggestion, biranzapine. This is medication, block M3 receptor, biranzapine. So biranzapine, anti-muscarinic medication, block M3 receptor, decrease acid secretion, number one. Number two, we can block histamine receptor, H2 receptor blockers. And you can see the minus here, that means block. So we have famotidine, Pepsid, or Pepsid. So famotidine block H2 receptor, block histamine receptor. This is another group of medication. We can use H2 blocker. And they said, for the prostaglandin, we can use analog of prostaglandin, something mimic the effect of prostaglandin. We have misoprostol. Misoprostol stimulate prostaglandin release. We don't have any medication affect the gastrin because the situation here is not applicable in the clinical practice. We don't have any medication currently affect the gastrin or gastrin receptor in the blood. Okay, they said another option there, we can block the proton pump, or the enzyme called, or the pump. So the pump could be blocked by something called proton pump inhibitors. So we have list of medication able to block the proton, and we call this one proton pump inhibitor. Give me a name for that, omeprazole. So we can see here now we have how many medication? We have several medication. Biranzapine, M3 antagonist. Famotidine, H2 blocker. Misoprostol, prostaglandin analog. Omeprazole, proton pump inhibitor. They said that's fine. So now we have number one, M3. Number two, H2 blocker. Number three, prostaglandin analog. Number four, we have proton pump inhibitor. Then number five, before we go to number five, they found later on, you can see here we have Helicobacter pylori. And this is one of the most common causes of peptic ulcer disease. So our target will be, in this case here, when we do the endoscopy and we take the biopsy, and the biopsy confirm Helicobacter pylori. So what we are going to do here, we are going to prescribe some combination therapy, could be triple therapy or quadruple therapy, to eradicate Helicobacter pylori. So we call this one Helicobacter pylori eradications. So 1, 2, 3, 4 here, and 5. This is maybe number 5 approach for that situation. Try to eradicate Helicobacter pylori. Other approach, okay, we have acid in the stomach, and you can see we have acid. What about using antacid? They said antacid could be target. This is number 6. Okay, antacid could be maybe possible. Okay, possible approach, antacid, to neutralize the acid in the GI stomach. And the last step, we'll be using the mucosal protective agent. And you can see here we have the ulcer here. If we use a green one, let me use a green one here, and we have ulcer, and this is the ulcer here. Okay, and we use some mucosal protective agent, and this protective agent try to cover the ulcer. So for example, when you have wounds on your hand, you put bandage on your hand. Try to cover the ulcer. Try to cover the wound or any ulcer in your skin. But we cannot maybe place bandage in our stomach. Therefore, we can use some medication able to protect the mucosa. So we have some protective factors, mucosal protective factors, and this will be number 7. So you can see here from this graph, I will clean all these, and then we try to maybe put the number for the medication used for peptic ulcer disease to make it like easy for us, and maybe so you can see here what we have. Our maybe list of medication used. Number 1, we can use muscarinic antagonist, H2 blocker, prostaglandin analog, proton pump inhibitor, eradicate Helicobacter pylori, antacid, or last one, mucosal protective agent. So you can see here we have 7 group in the practice, in the clinical practice. Someone maybe argue about Gastrin. It's not, to my knowledge, we don't have medication affect the Gastrin in the practice. Okay. Okay, we have practice question here, and the question: which of the following is or are capable to inhibit gastric acid secretion? Select all that apply. So we're looking for agent or mediator, or like local mediator, or like hormones or anything inhibit gastric acid. So which of the following agent inhibit gastric acid? Which of the following inhibit gastric acid? So I will start with the first one, and yes or no. Acetylcholine inhibit gastric acid, yes or no? If you said no, you are correct. Histamine, no. Gastrin, inhibit gastric acid, Gastrin, no. Somatostatin, if you said yes, you are correct. NSAID, what about stress? What about Helicobacter pylori? Prostaglandin, inhibit gastric acid? Correct. Okay, so anything inhibit gastric acid in this list, we have somatostatin inhibit and prostaglandin inhibit. So acetylcholine, histamine, gastrin, NSAID. So the correct answer will be, according to this one here, somatostatin and prostaglandin. Okay, another maybe case, or like fill in the blank. They said acetylcholine or acetylcholine acting on the M3 receptor. What happened there? Acting on the M3 receptor, blank, the blank pathway resulting in increased proton pump inhibitor. So do you think M3 receptor stimulate the cyclic AMP, stimulate the calcium, or inhibit calcium, or inhibit cyclic AMP? So which one will be involved in the acetylcholine acting through M3 receptor? Stimulate what? Stimulate cyclic, M3 receptor stimulate cyclic AMP, stimulate calcium, inhibit calcium, or inhibit cyclic AMP? This will lead to take you to the previous slide, only to show you what we have. Okay, this is acetylcholine here, bind to the M3 receptor, activate GQ protein, increase calcium, you see it here, and this will lead to the activate protein kinase here. If you go back, we have protein kinase, activate protein kinase. So if you go to the slide, okay, which one here will be, okay, what do you think? Stimulate calcium dependent. So acetylcholine binding to the M3 receptor, this will lead to the stimulation of calcium dependent and activates